We're seeing younger and younger patients come in with skin cancers that are confirmed with a skin biopsy. I recently had a young woman in her 30s diagnosed with a melanoma on her face. And this is not something that you expect in younger adults, but we're seeing it more and more. And research studies are showing that younger adults, specifically Gen Z, are less likely to use sunscreen and less likely to use sun protection habits. And a lot of it is due to the influence of social media and influencers on Instagram and TikTok and other social media outlets. So there are a lot of misconceptions on social media. There's a lot of misinformation, a lot of skepticism about sunscreen. There is this huge misconception that sunscreen is toxic and causes cancer. And this is not something that has been proven. Sunscreens that are FDA approved have been shown to be safe and effective at reducing the risk of skin cancer. What we know does cause cancer is UV radiation from the sun. So that is officially classified as a carcinogen. So there is another misconception that if you have brown skin or if you have dark skin, you don't really need sunscreen because you're not likely to get a skin cancer. Maybe you can wear sunscreen just to make your skin more even or to prevent some premature aging, but that's really the biggest risk. And that's actually not true. So I am seeing patients with dark skin come in not only with precancers, but also with skin cancers in UV exposed areas. And when patients are diagnosed, for example, with melanoma and they have dark skin, historically, we've seen those patients get diagnosed at a later stage and face increased morbidity and mortality because the patients were diagnosed later than if maybe they had fair skin because it was unexpected. So it's critically important to understand that the risk might be lower if you have dark skin, but it's not zero. And we do recommend that you use those photoprotective practices and that you protect your skin just like anyone else. There is a misconception that the only way that you can get your vitamin D is by going out in the sun and synthesizing vitamin D from UV exposure. And while some people specifically with fairer skin, may synthesize some vitamin D with UV exposure, it's really not sufficient for your nutritional needs. And getting that much UV exposure where you're synthesizing more vitamin D also increases the risk for skin cancer, especially for those with fair skin. So what I recommend is that you consume vitamin D rich foods, your dairy, and different types of fruits and vegetables, and that you do your usual UV protective methods because you're just not making enough vitamin D to make it worth the risk. If you have darker skin, we've seen that vitamin D synthesis is actually lower with UV exposure. So there's an increased risk for vitamin D deficiency. So it makes it even more important for individuals, whether they have fair skin, medium skin, or dark skin, to consume enough vitamin D either with supplements or with their diet and not depend on UV exposure.